So I'm going to be talking about how to keep sheep and goats healthy. My name is Susan Schoenian. I'm the sheep and goat specialist for University of Maryland Extension. Helping out in the chat box is Megan Perdue. Megan is an agricultural educator in Worcester County, Maryland. That's over by the ocean, and I'm in the mountains, that part of Maryland that gets really skinny. Okay, so let's get started. So these are kind of the things I want to talk about tonight. I want to talk about biosecurity, quality assurance, vaccinations, common diseases, and then the most common disease for most of us is parasites. We'll get into a little bit more detail on parasites. I think it's important to understand that there's kind of two kinds of diseases. Some are endemic. They're going to be wherever you have sheep and goats. Things that are caused by bacteria, things like that, environmental causes, those don't get introduced to a farm. But many diseases get introduced to a farm because they walk onto that farm. And for that reason, one of the most important aspects of animal health is biosecurity. These are the things that you undertake to prevent diseases from being introduced or spread. And I think you understand in today's world that things like this are getting even more important, not only for human health, animal health, but human health. And now they have this thing that they call One Health, where we put human and animal health kind of together. One of the strongest features of biosecurity should be isolation. If you acquire a new animal, that animal should be put in quarantine. It should be isolated at least 2 weeks, preferably for a month, if not 2 months. It takes that long before you're going to see certain diseases. Traffic controlling who comes into your farm. This is a sign that's available from the Secure Sheep and Wool Supply Program, an ASI program. You can have these signs printed. And then, of course, sanitation and good husbandry, all of those things are gonna be part of biosecurity. So as I already mentioned, quarantine new animals for at least 2 weeks, preferably 30 days, maybe even 60. Make sure those isolation areas or pens do not share the same airspace as the main flock or herd. Usually we isolate inside in a pen, not in a pasture. You need to do several things while the animals are in isolation, because there's some things that you're definitely concerned about. You want to make sure you buy healthy animals and buy from reputable breeders. But even so, you want to trim and inspect the hooves of every animal you buy. Ideally, you want to soak the feet in a zinc sulfate solution, or you can spray it, or you could spray copper tox. But you want to really be vigilant about not introducing foot rot, and that's one of the diseases I'm going to talk about. The other concern that we have when we buy new animals is we know they have worms because all sheep and goats have parasites. They all have worms. But an introduced animal could have more resistant worms than already exist on your farm. So we want to make sure we don't introduce resistant worms. And the way we do this is we give them a combination treatment. And this is a case where we want to have as close to a 0 egg count as possible. So by a combination treatment, I mean you give a dewormer from each of the dewormer classes, the most potent dewormer from each class. This is usually albendazole, which is valbazen, moxidectin, which is cydectin, and levamisole, which is prohibit. And you do a before and after fecal egg count, say 10 to 14 days later. And you really would like to get that egg count near 0 before you introduce that animal to the rest of your herd, before you introduce that animal onto your pastures. The one thing I don't have listed on this particular slide is not only animals that you buy or newly acquire, but animals that have been exhibited. You should isolate them as well when they come back to the farm. The other thing that you can do during this quarantine period is you can use this as a time to test for diseases. Again, I think a lot of this stuff is just getting a lot more important. More of us are concerned about making sure we don't introduce diseases like CAE, OPP, Yonis, and things like that. Quality assurance is just a kind of a catch-all term for saying you're going to use animal health products properly. We have to understand that with sheep and especially goats, a lot of the medications that we use require extra label drug use. Extra label is when you use a drug in any manner that is different from the label. So you take a drug like Cydectin, it is labeled for sheep, it is not labeled for goats. The new Mastitis Vaccine is labeled for goats and it is not labeled for sheep. In order to legally use these medications, a veterinarian has to be involved. A veterinarian is the only person that is legally allowed to either use or prescribe drugs extra label. So it's very important that each and every one of you have a valid veterinary client-patient relationship. And I know sometimes it's hard to find a veterinarian that'll work with small ruminants, but it is absolutely essential. Again, a lot of the medications are extra label, and a lot of the medications we take for granted, at least in the US, some of the antibiotics that we're able to buy over the counter, they are transitioning to prescription. I don't know exactly when that's going to happen, but it's in the works. So not only will you need a prescription if you wanted to feed an antibiotic or put an antibiotic in the water, but if you just want to use penicillin or LA200, you're going to need to get that from a veterinarian. So if you don't currently have a vet, start working on finding one and developing that relationship. And another important part of quality assurance is keeping records. Keeping records. When you use medications, who you give them to, the withdrawal period, and things like that. So it's very important. Quality assurance is very important. The American Sheep Industry Association actually has a sheep safety and quality assurance training. It's 3 levels that you can do. And Langston University has one for meat and dairy goats. So you might consider, it should come in handy for marketing and talking about your business, but you should look into doing this, at least following the practices that are set forth in those trainings. Okay, I want to talk about vaccinations. We got a little bit into vaccinations last week with our talk on management. There's a lot of things that you can vaccinate sheep and goats for, but the only universally recommended vaccination is for Clostridial diseases. So Clostridial diseases, they are bacterial diseases. They're usually already there. They're in the soil, or they may be in the animal's gut. There are 3-way and 8-way vaccines that I'm going to talk about. There are other vaccines that can be given. I think I got another slide where I talk about these. So I'm going to skip forward on this slide. So let's talk about the Clostridial vaccinations. The 2 products that we have are Cdt, and there's different brands, and some are approved for goats and some are approved for sheep or for both. And then Covaxin 8, which has protection for additional Clostridial diseases like blackleg and redwater, as well as CD&T. And CD&T stands for Clostridial perfringens type C and D, what we call enterotoxemias, or overeating disease, and the T is for tetanus. And again, Covaxin 8 adds some additional Clostridial diseases. And the choice of which one of these to use depends on your situation, much like what else should I vaccinate for? It depends on where you're located and what you're at risk for. We mentioned last week in the questions that the dose for the Cdt vaccine is 2 mils, 2 cc's, 2 doses the first time an animal's been dosed. And for Covaxin 8, the initial dose is 5 mils and the second dose or booster dose is 2. What we ideally want to do is vaccinate pregnant females 4 to 6 weeks prior to birthing, but at least 2 weeks prior to birthing. This way, when the lambs and kids consume the colostrum, they will get temporary passive immunity to these diseases for what she was vaccinated for. And then the lambs and kids won't need vaccinated until they're about 6 to 8 weeks of age, and then a booster 10 to 12 weeks later. It's at about that time, about 6, 7 weeks, that passive immunity starts to decline. If you vaccinate much earlier, or if you vaccinate, like a lot of people want to vaccinate as soon as they're born. And I'm not saying it's not going to have some effect, but it's going to be less effective the younger the animal is. A number of years ago, Cornell University did a study looking at Cdt vaccinations, and they showed that they were most effective when they were at least 4 months old, but they advocated against vaccinating like a couple of days old when they're in the lambing or kidding jug. But if mom didn't get vaccinated, she's probably still going to have some immunity if she herself was vaccinated as a lamb or kid, but it's just not going to be as effective. If you want to maximize immunity for the Clostridial diseases, then you will vaccinate the pregnant female in her last trimester, and you will vaccinate the kids and lambs twice. Now, a special case is our orphaned lambs and kids. Chances are they didn't get colostrum or didn't get enough colostrum. They're at much higher risk for the enterotoxemias, particularly type C. And so you should vaccinate them earlier and more frequently. I've read some veterinarians advocating every week, every 2 weeks. The withdrawal period for most vaccinations is 21 days. So always keep that in the back of your mind. For those of you who sell young animals, say at Easter time, keep in mind, 21 days is the withdrawal period for the Cdt vaccines. So these are the other diseases that you could potentially vaccinate sheep and or goats for. There is an abortion vaccine for chlamydia, which is enzootic abortion, and there is one for Campylobacter, which is vibrio abortion. It is a sheep vaccine. I wouldn't say that everybody needs to do it. The risk varies. It's probably more prevalent and in the Western United States in the range operations. But there is like I said, there is a vaccine for sheep. For CL, there is also a vaccine. I think its efficacy is questionable. There was a paper that just came out questioning the efficacy of it, particularly for goats. And it also often causes abscesses itself when you vaccinate. It is not recommended that this vaccine be given to goats, but there is a CL vaccine, and there is one that combines CL with the enterotoxemias. There is a foot rot vaccine. It covers about 20 of the strains of foot rot that we have here in the US, but unfortunately it's not readily available. The wool growers out in California, and I think a few other Western states, had been able to get some of the vaccine in, and I don't know what the status of that is. There is one, but it's not readily available. I think last week we talked a little bit about the new Mastitis vaccine that is approved for dairy and meat goats, not for sheep. It covers staph infections, which are the most common cause of mastitis. There is a pneumonia vaccine for sheep and goats. It covers Pasteurella. There is a rabies vaccine for sheep, and it can be given extra label to goats. And there are some situations where you might want to vaccinate for rabies. Again, all of this is looking at what's happening in your operation and what the risk is. Do I have a high enough risk that it's worth vaccinating for? Is vaccination going to cover what losses I might get? There is a sore mouth vaccine. Again, I don't know that it is effective in goats as it is sheep. It's a live vaccine, so that means you are handling the actual virus. And because it's a live vaccine, the last thing you want to do is use it if you haven't previously had sore mouth, because you will establish sore mouth on your premises if you use the vaccine. Because essentially, with the sore mouth vaccine, you're giving the animal sore mouth. You're just choosing when and you're choosing where. So you're trying to minimize the risk of it occurring at the wrong time, like at lambing, kidding time, or a time of the county or state fair. And instead of having the lesions on the face, you're hoping to get the lesions on places that aren't going to be as problematic. Typically, it's given on the woolless flank on a sheep. When we did our buck test, we used to give it, we did it on the tail head, and then we did it in the ear, believe it or not. And I can tell you that the vaccine did not seem to be that very effective in the goats. But these are all things that you could vaccinate for, and you need to, again, look at your individual farm, talk to a veterinarian or other knowledgeable animal health person to see if you should add any of these to your vaccination programs. So you definitely do CD&T, but these you need to do only as need basis. And plus some of them you wouldn't do unless you already had the problem, like CL, like foot rot, and like sore mouth, okay? And then others hopefully to prevent. Something like pneumonia, Pasteurella is already present on your farm, you know, so the decision isn't the same for that one. Okay. When you do use vaccines, we need to make sure we use them right. Number one, follow the instructions on the label. Use appropriately sized needles. There's no reason to use a 1.5-inch 16-gauge needle to give a lamb or kid a vaccine. I usually, for subcutaneous injections, I usually use a 1/2 inch, and I'll either use, on young lambs, I'll use a 20 gauge, and sometimes I'll use an 18 gauge. Generally speaking, you want to use the smallest gauge needle as possible. For a subcutaneous injection, there's several places that you can give it. You can give it in the loose skin in the neck region. I think that's usually a little bit easier in goats than it is sheep. You can give it over the ribs, or you can give it behind the shoulder. Those are all suitable places for giving subcutaneous injections. You want to change your needles frequently. If you have a small farm, I would say every animal should have a clean needle. As your numbers get bigger and you may be using some automated equipment, you're probably just going to change the needles every so often. One of the most important things you need to do is not to draw the vaccine out of the bottle with a needle that you've previously injected into an animal. So you want a separate needle to draw vaccine out of the bottle. All of the labels will tell you that you should use the entire contents when open. So that's going to influence sometimes the size of the CDT comes in 50 mils and it comes in 250. So for small flocks, you're probably going to be, you know, you're going to buy the 50 mils. And for a medium-sized flock, you might even buy several 50 mils because you want to use them up. You want to use the contents up and not use it, say, 2 weeks later. You want to make sure you dispose of the sharps properly. This is a sharps container, but you can make a sharps container out of a lot of different things. And as long as they're contained in there, you can take it to most landfills. And again, a reminder that the withdrawal for vaccines is 21 days. Okay, now I want to talk about some common diseases of sheep and goats. In no way can I cover everything possible that sheep and goats can get in this relatively short webinar. So I'm going to talk about foot or hoof diseases, respiratory diseases, nutritional, some that are related to pregnancy, and then I'm going to end with internal parasites, which is in many of our climates is the worst, most common health problem that we have with small ruminants. So starting with hoof diseases, and there are more than these two, but primarily there are these two, which is foot scald and foot rot. And they are bacterial diseases. They involve either 1 or 2 bacteria. You can see the picture on the left of foot scald. You get that reddening in the skin between the 2 hooves or toes. And then the picture on the right, which is foot rot, that's actually maggots you're seeing in that hoof. So foot scald is a problem in high rainfall areas, generally speaking over 30 inches. As I mentioned, it's that red irritated skin in the interdigital area between the toes. It's caused by the bacteria F. necrophorum, but it can also be in combination with a more benign strain of the other bacteria. And it's essentially the precursor or facilitator of foot rot and foot abscesses and that sort of thing. That's kind of where it starts. Foot rot, which is in the hoof, the infection is in the hoof, is definitely one of the costliest diseases in the sheep and goat industry. It's a big welfare issue as well. It's highly contagious. Foot scald is generally environmental. The conditions are really wet, and so most of the animals develop that irritation between their toes. Foot rot, on the other hand, is highly contagious, and it's caused by the interaction of both of those bacteria with more virulent strains of the second bacteria. And as I mentioned before, with regards to the vaccine, there are 20 strains of this bacteria in the US that can cause foot rot. So how do you control and preferably eradicate foot rot? It's all based on the concept that the organism that causes foot rot can only live in the soil outside of the animal for 2 weeks. So we use that to our advantage. So step one to control and eradicate foot rot is to examine all the feet of your sheep and sort those animals into 2 groups, an exposed or clean. They're clean, but they're exposed, and an infected flock, because we're going to keep those animals separate. Trim the hooves and soak the feet in 20% zinc sulfate solution. If you just have a few animals, you can also spray the individual hooves. So put those animals on clean ground, so ground that hasn't had any sheep or goats or cattle for at least 2 weeks. Then repeat this procedure in 2 weeks. The animals that don't respond, you should cull them. You can speed up this process with vaccination. As I mentioned, unfortunately, the vaccine is not readily available, in antibiotics. In fact, in Europe, they seem to take more of the antibiotic perspective, and they actually discourage hoof trimming very aggressively because they feel that that can make the hoof more prone to get foot rot. So you can treat these animals with a long-acting antibiotic. So penicillin's been used, and LA200s have been used. Both of them are extra label, but the most effective antibiotics are Zactran and Draxxin. Both of them are prescription antibiotics. There have been a number of studies in Europe that showed that 1 injection of Zactran was highly effective. And once again, animals that do not respond to antibiotic therapy should be culled. Culling is one of your most powerful tools, not just with foot rot, but with a lot of diseases. Get rid of what you don't want. Another big category of diseases, and it's not a single disease, but I'm just going to kind of collectively call it respiratory disease or respiratory complex. Respiratory problems can be caused by viral or bacterial infections and some parasites, such as lungworms or the nasal botfly. The disease can be acute, chronic, or progressive. There are many stress factors that cause respiratory problems, including overcrowding and poor ventilation. We tend to have more problems with respiratory problems in confinement in buildings, and ventilation is a big aspect of that. Respiratory disease is treated with antibiotics and anti-inflammatory drugs. All those antibiotics are extra label for goats. Most of them are for sheep, the more powerful ones. For example, if you're creep feeding your lambs and kids and they ran out of feed, and then all of a sudden they got all the feed they can eat, you need to be careful about things like that. There's 3 kinds of bloat that we can see in sheep and goats. Probably bloat's more common in cattle and less common in goats, but they can all get it. It's an accumulation of gas, and they're not able to expel that gas. I don't know how well you can see that picture in the middle, but she's got a distension of her left side. This was a sheep of mine that had what I would call a mild case of bloat. So the 3 kinds are frothy or primary bloat. Primarily occurs on pasture. Primarily it's associated with the consumption of legumes like alfalfa and red clover, but it can also occur with forages that simply have high starch levels. For example, fresh spring forage, annual forages that are really nutritious, and also it can even occur with finely ground grains if you grind them, like corn especially. With free gas bloat, that's a secondary bloat. We often call that grain bloat, and it's most typically associated with grain feeding. Abomasal bloat is associated with the artificial rearing of lambs and kids, and so it's mostly bottle-fed lambs and kids. So the first 2 affect the rumen and reticulum, and the abomasal, of course, because it's a pre-ruminant, it affects the abomasum or the true stomach. So how do you treat and prevent bloat? Well, one of the ways you can you treat bloat, you have to break down that froth or that foam with mineral or cooking oil. You have to do that first before you can do anything else. And then if you can pass a stomach tube. And in late stage bloat, when they're really bad off, they will take a trocar and they will penetrate the rumen to relieve that gas. Free gas bloat is pretty similar, although I think in many cases you can catch them before they're really, really serious. and treat them with antacids. As they're more advanced, you can pass the stomach tube. In terms of the abomasal bloat, you prevent that with proper milk feeding. One of the reasons bottle lambs are challenging is because with a bottle lamb, we feed them lots of milk infrequently, like say 2 times a day. Whereas if they were on their dams, they would nurse a little bit at a time, and they would do that frequently. So that's why they're at high risk. It's why it's a good idea to give them Clostridial vaccinations at earlier and more frequently than the other lambs. And you treat it with sodium bicarbonate, baking soda, and antibiotics. The other ways to prevent these the frothy and free gas bloat are pretty similar to the 2 diseases on the last page. Is, never just turn animals into something all of a sudden. All of a sudden, you turn them into a field with legume, with lots of legumes in it. Fill them up with hay. Make transition slow. Even sometimes transitioning back to forage can be challenging. I know in the spring of the year, when my ewes have lambed in the barn, and then we've got all that fresh grass, I try to transition them very slow. So no matter what you're transitioning to, make it gradual, increase it gradually. The bigger challenge or the bigger risk is with going to a more concentrated diet, but there's also challenges with our forage diets as well. A couple of more nutritional or metabolic diseases. We talked a little bit, I think, about urinary calculi in the last session. Urinary calculi is the formation of stones or calculi in the urinary tract of male sheep and goats, especially wethers and pet goats. And the reason it's most common in wethers and pet goats is because mostly because of how they're fed. We associate urinary calculi primarily with concentrate feeding. It's caused by an imbalance of calcium and phosphorus in the diet. Things like corn, barley, and soybean meal, they are all high in phosphorus relative to calcium. Now, we can also get stones caused by feeding too much calcium in the diet. Say putting a wether goat on an alfalfa hay diet, you're kind of asking for problems. So the way we prevent urinary calculi is with proper feeding. It is caused by nutrition. So we need to have a proper balance of calcium and phosphorus in the diet. It should be at least 2 to 1. Just like those other diseases, we need to have roughage in their diet. And we need to have an adequate water supply. And very often we'll feed salt to encourage, or minerals to encourage them to drink enough water. If you buy commercial rations for feeding out lambs or kids, they usually add ammonium chloride to the diet to help prevent urinary calculi. The treatment for this disease varies. If you catch them way early, you could try drenching them with ammonium chloride. It's not very tasty, so it's a bit challenging. And if you go to the real extreme case, there might not be any hope, and you're going to have to humanely euthanize the animal. Or in some cases, surgeries can be done. In most cases, it requires the intervention of a veterinarian. Another somewhat common nutritional disease is polio. It's caused by either a thiamine, vitamin B1 deficiency, or diets that are excess in sulfur. Distillers grains put them at risk for polio. So polio basically causes neurological symptoms, stargazing. What I mean by that is that animal will just be kind of looking up, he'll be standing and kind of looking up at the sky, exactly what the words sound like. He may push him into objects. The classic symptom is blindness. Polio is also one of the diseases that responds most quickly to the proper treatment and early treatment. You treat it with thiamine, which is, again, vitamin B1. You have to obtain that from a veterinarian. B-complex vitamins, as long as they have thiamine in them, are also used to treat polio, and they are available over the counter. In real advanced cases of polio, you may need to give an anti-inflammatory drug such as dexamethasone, and of course, this would be a prescription treatment. Polio is most commonly associated with concentrate diets. These are metabolic diseases, but also related to pregnancy. Pregnancy toxemia or ketosis is probably one of the most common nutritional diseases in sheep. It's low blood sugar. It's caused by an insufficient intake of energy during late pregnancy. When in the last 6 weeks of pregnancy, when the fetuses are doing most of their growth, there is a substantial increase in the amount of energy that ewes and does need to consume. And sometimes hay is not enough. So it's typical to feed a little bit of grain during that last trimester. Those that are most susceptible to pregnancy toxemia are those that are carrying multiples. In fact, they sometimes call this twin lamb disease. Other ones that are prone are fat ones, timid ones, like a real old or real young one. Maybe they don't get their fair share at the feed bulk. How we treat it depends on the progression of the disease. Sometimes you just notice a ewe or doe lagging behind. They're slow getting to the feeder and they're sluggish. And you can very often treat that with oral glucose. With many things, propylene glycol is the most common thing given, but even sources of energy that you have in your house, like molasses and apple cider vinegar, things like that can help. A little farther along, you can give them a subcutaneous injection of glucose. And in more advanced cases, she would need it via an IV. And in some cases, you may need to induce parturition, because once the offspring are delivered or out of her, then she no longer has that demand on her. Milk fever is low blood calcium, and it's caused by an insufficient intake of calcium during late pregnancy. This is most common with sheep, but it can also be caused by too much calcium in the late gestation diet. This is more common with dairy goats. Again, just like with pregnancy toxemia, what you treat it with depends on how far along the disease has progressed. Both of these diseases can present with similar symptoms. Very often the vet will treat for both of them at the same time. They're two different diseases, but like I said, they're very often treated together. Pregnancy toxemia is more common. Milk fever, to prevent that, you want to make sure that there's sufficient calcium in the diet. The requirement for calcium for sheep peaks in late pregnancy. It peaks in lactation in goats. If you're just feeding a grass, hay, and corn, you could quite possibly be deficient in calcium. If you feed like a mixed a grass and legume hay, that's the kind of the perfect hay for late gestation. Save your very best hay for lactation. So like a lot of things, we want to feed, and the same thing is true with preventing pregnancy toxemia. We want to feed to meet their requirements, but exceeding their requirements significantly can also cause problems. Can't do a talk about sheep and goat health without at least mentioning scrapie. Scrapie is an important disease from a regulatory standpoint. It's not one that 99.99% of producers are thankfully ever going to experience, but our country is trying to eradicate the disease, so it requires the involvement of all of us, whether we have one sheep or goat or 50 sheep or goats or 1,000. It doesn't matter. We need to get rid of this disease. So scrapie is fatal. It's always fatal. It's a degenerative disease affecting the central nervous system of sheep and goats. It's in the same family of diseases that are classified as TSEs, or transmissible spongiform encephalopathies. This also includes mad cow disease. It includes chronic wasting disease. And of course, there are a few human diseases, and I think there's one for cats and one for mink as well. So it's in that family of diseases. Unlike mad cow, which is believed to have been spread with infected feed, scrapie is spread during the lambing and kidding season. It's spread via the placenta and placental fluids. Scrapie has a 2 to 5 year incubation period. As I alluded to, it's got a very low prevalence in the US due to eradication efforts. But in order to eradicate scrapie, we need to find where it's at. So all sheep and goats, when they leave the farm of origin, need to be identified. Each state has, there's federal regulations and there's also state regulations. So there could be some differences in state. But generally speaking, your sheep or goats need identified when they leave the farm of origin. They go to the sale barn, they go to the county fair, you sell a ewe for breeding, they should be tagged. There's the number, I think we gave this out last week, where you apply to get a premise ID number and find out where you can buy the ear tags. You can also you can use tattoos for registered animals, but if they enter commerce like a sale barn, that's probably not going to be sufficient. Tags are desired. And the other thing that we all need to do is we need to report or test any scrapie suspect animals. If you had an animal present with neurological symptoms, there's lots of different things it can be, and two of the things it can be is scrapie and rabies, and those are both diseases that need to be identified. So we, and even if you just have an older animal die a natural cause, it would be very helpful to have that animal tested, because we do want to get rid of this disease. It's very costly in kind of a big picture way. Okay, I'm going to switch over to parasites for the rest of the presentation. There's two types of parasites that affect sheep and goats: internal or endoparasites and external or ectoparasites. I'm not going to talk a lot about the external parasites, but lice, ticks, flies, fleas, and mites. We can treat those with a macrocyclic lactone dewormer. That group includes ivermectin, Dectomax, Epronix, and Moxidectin. The drug of choice is usually Ivomec. Sidectin is in a subgroup within that group of dewormers and is more effective on worms, and ivermectin is more effective on external parasites. It's labeled specifically for nasal bots. We can also treat these problems with insecticides that can't contain permethrins. So that's the other route that we can take. And a lot of it's going to depend on your situation. A lot of certain external parasites are more common in other places, are more common with certain types of sheep. I'm going to focus here on the other side with the internal parasites, specifically the roundworms and the protozoan parasites. A little bit about the other two, tapeworms. A lot of people worry about tapeworms because it's really the only parasites you can really see in the feces. And so we see that and we think, wow, they're just totally infected, and who knows what's going on in that animal. It can't be good for them. But interestingly enough, there's no solid evidence that tapeworms are very pathogenic. There are rare cases where they cause a blockage. There's rare cases where they slow down gut motility and predispose the animal to enterotoxemia. Both of those are not the worm itself, but the physical size of the worm. And if you do feel the need to treat for tapeworms, you need to use a specific dewormers. Valbazin is labeled for tapeworms. Safeguard is not labeled, but can be effective at higher dosages. There's horse dewormers that contain praziquantel in them. That's actually the drug of choice for tapeworms. Liver flukes are going to be specific to specific areas of the US and other countries. They're generally considered to be a parasite of the Gulf states, the Great Lakes area, and the Pacific Northwest. That's where they're considered to be more of a problem. Protozoan parasites are things like Coccidia, Giardia, and Cryptosporidium, and they also can be a problem with sheep and goats. But I'm going to pick the two big ones, the two parasites that cause, by far, in most circumstances, the most problems on our sheep and goat farms. The first one's Coccidia, and there are different strains of Coccidia. And then there is the barber pole worm. I think hopefully most of you are familiar with that. That's called Haemachus contortus. Coccidia primarily infects the intestines, and the barber pole worm is found in the abomasum or true stomach, and that's what that's a picture of. I want to talk about Coccidia first because I'm going to go into a little bit more detail with the stomach worms. So Coccidia are single cell protozoan parasites that affect the small intestines. They are species or host specific. So even the strains of Coccidia that goats get are not the same as the ones that affect sheep. The other interesting thing is they're not all pathogenic. So if they're infected by like 6 different strains, chances are only 1 or 2 of those is disease causing. The most common symptom of Coccidia is scours. This kid right here to me looks like classic Coccidia. It's not just the fact he's got evidence of scours, but he's poor. he's not thriving. His thriftiness is very poor. When we get clinical coccidiosis, and coccidiosis can be clinical or subclinical, it's possible the subclinicals probably causes more economic loss than the clinical at times. We treat with either amprolium, which is trade name Corid, or with sulfa antibiotics called dimethox. A few years ago, any antibiotic that is put in the water was transitioned to prescription, so dimethox has to be obtained by a veterinarian. None of the treatments for Coccidia are FDA approved for sheep and goats, so all treatments should be done under the advice of a veterinarian. Corid, you can buy it over the counter, but you would probably benefit from the assistance of a veterinarian in terms of what dosage to give. When animals have coccidiosis, you don't want to put it in the water. You actually want to drench the animals individually. Preventing coccidiosis, like everything else, starts with good sanitation and good husbandry practices, making sure feeders and waters are free of fecal matter, making sure you have feeders that keep the animal's feet out to the best of your ability. Clean, dry bedding, avoid overstocking your pens. And, and common sense things, not having leaky waters, being concerned even on pasture about how the animals might congregate. We think of coccidiosis as more of a problem in confined animals, and it usually is, but I have known many, many coccidia outbreaks to occur in pastured animals because things like water, minerals, and shelter tend to cause the animals to congregate in the same place, and that's where the risk is. Fortunately, we have coccidiostats that we can put in the feed, the mineral, the water, and or the milk replacer. There's several products. Bovatec is approved for sheep, confined sheep. Rumensin is approved for goats, confined goats. And Decox is approved for both species. Amprolium or Corid, which again is extra label, can also be used as a preventative in the water. And then in terms of natural control, the one that has shown the most promise is Sericea lespedeza. That can be grazed, fed as hay, or fed as pellets, and that seems to have a negative effect on the Coccidia organism, reducing not only the oocyst counts, but also the clinical signs of Coccidia, improve the fecal consistency scores. Its availability is the biggest challenge. And it will probably be, it's more likely to be available in the southeastern United States than any place. Okay, now we're going to talk about the barber pole worm. This is the worm that causes the most, probably the most economic loss. It's a blood-sucking roundworm in the abomasum. It's highly pathogenic, so highly disease-causing. It has a short direct life cycle, about 21 days. It's a very prolific egg layer. So when somebody tells me a goat or sheep has an egg count of 1,000 eggs per gram, I'm actually not that concerned because that's not that high for the barber pole worm because she lays lots of eggs. The other thing that makes them a challenge to control is they have an ability to, when I say they, the barber pole worm and similar stomach worms, they have the ability to go into a hypobiotic or arrested state when the environment is not conducive to their development. So the barber pole worm primarily causes anemia, so blood and protein loss. And they may cause bottle jaw. That's a picture of a lamb with bottle jaw. The important thing about bottle jaw is two things. One, once they present with bottle jaw, they're not that far from dying unless you get an effective treatment in them, a combination treatment. And then the other thing is not all animals, especially goats, will present with bottle jaw. So you're going to need to handle those animals and check for anemia. And sudden deaths are not uncommon with the barber pole worm. So there's two ways to control the barber pole worm and other strongyles, which are the roundworms. One is management and husbandry, and that should be first, and that should be 90% of what we do. And the second is dewormers. So what do I mean about management and husbandry? Well, this could be an all-day course in itself. First thing is to look at host immunity. Who is the most vulnerable animals on the farm? The animals that are most vulnerable to parasites, the barber pole worm, are the young lambs and kids that are less than 6 months of age, and especially if they're not on a very high plane of nutrition. The other is the parapartrit female. So the ewe and the doe have a reduction of immunity to parasites that they have developed with age at the time of lambing and kidding, about 2 weeks before up to 8 weeks after. So they're very vulnerable. So your efforts need to really focus on them because they're the most vulnerable animals in the herd and flock. All right, so what are the things we do to prevent parasites? One is short duration grazing. The fastest amount of time that a parasite barber pole worm egg can go from egg to third stage infected larva. So the egg hatches and it goes through a couple of molts. It becomes third stage infected larva. The animal consumes it, is for 3 or 4 days. So if you rotate your pastures every 3 or 4 days, that should make great strides toward preventing parasitism. But that has to be combined with long rest periods. By long, I mean sometimes up to 60 days. Because it does you, if you keep them on the property or the paddock too long, they will get reinfected. Because again, 4 days. If you come back to the same paddock too quick, they will get reinfected. So we've got to allow some time for those eggs and larvae to die off. And it's very weather dependent. It takes longer in cooler weather than it does in not cold, but I mean cooler, like fall, than it does in the summertime with all the heat. We need to have minimum grazing heights. Most of the worm larva is found in the first 2 inches of vegetative growth. So if we force animals to graze that low, then they're going to ingest a lot of infected larvae. Mixed species grazing is a strategy for controlling parasites in small ruminants. For the most part, sheep and goats are affected by the same worms, but mostly they're different from cattle. There's some cross-infection with the barber pole worm with calves. There's no cross-infection with, say, equine or other species. So we can use them in a leader-follower system. We can use them in a co-grazing system. Planting alternative forages, including annuals. Annual would be a clean pasture, and forages that contain tannins can help us with parasites. And the primary species we're talking about here, again, is Sericea lespedeza. It's a warm season, it's a legume, a warm season legume. And a lot of research has been used to look at its effect on parasites. And while they don't always know exactly why it does what it does, it definitely reduces parasitism with the barber pole worm. Browsing is an important way to limit the ingestion of larvae, because especially true with goats, when their head's up off the ground and they're browsing, they're not ingesting worm larvae. Taking off a hay or grain crop will also create a cleaner pasture. And then genetic selection. Again, get rid of what you don't want. Make sure that your male, because he makes up half the genetics in your herd, and after a few years of breeding, probably 90%, make sure he's an animal that doesn't need dewormed all the time, and even take some fecal egg counts and make sure he's not a big egg shedder. Get rid of the very worst females in terms of parasites. The other way, and should be considered the last resort for controlling or managing parasites, is the dewormers. The proper use of the dewormers, and one of the things we have to try to do as we control parasites is that we maintain refugia. Those are worms in refuge that have not been exposed to the dewormers, therefore they stay susceptible. And targeted selective treatment or non-treatment is what I'm going to talk about next. So targeted selective treatment or non-treatment is when you only treat the animals that require deworming or would benefit the most from deworming. I tell people with small flocks, you should definitely deworm the ones that need it, require it. Maybe in a large flock, it's as much identifying some that you don't have to treat. Research shows that if you'll just keep 10 to 20% of the group or flock untreated, that will create sufficient refugia. So targeted selective treatment reduces deworming and increases refugia. We have 3 decision-making tools to help us decide when or who needs treatment or who doesn't need treatment. The first is the FOMACHA eye anemia system. Hopefully most of you are familiar with that. This FOMACHA card that you see in the picture, it estimates the level of anemia in the sheep or goat or llama or alpaca. And you can see that the lamb in this picture, that's pretty close to a FOMACHA 1. So this animal isn't showing any signs of anemia. So anemia is the primary symptom of marble form infection, so pale mucous membranes. Some people say, oh, I can look at the gums. Sure, you can look at the gums too, but the color of the lower eyelid is what's been researched and kind of calibrated. So there's 5 scores you can see on that card. A 1 and a 2, they're not anemic, they don't require treatment, and a 4 and a 5 require treatment. Then you can see there's a big question mark on 3. Sometimes you're going to deworm a 3, sometimes you're not. So you're going to compare the color of that lower eyelid to the colors on the card. There's a very specific technique for doing this. It's called cover, push, pull, pop. You cover the upper eyelid, push down slightly, and when you pull down that lower eyelid, the membranes sort of pop out. So that's cover, push, pull, pop. If you want to get a FOMACHA card, you have to take a training in order to get them. And because of COVID, we do now offer online trainings. But hopefully in your area, there might be some local workshops, because that's always the better way to learn. The problem with the FOMACHA system is it only works for blood-sucking parasites like the barber bollworm. And then another challenge with the FOMACHA system is, what do I do with FOMACHA 3s? There's a question mark. So what the 5-point check does is it adds criteria for other parasites, the ones that cause digestive upsets, that cause scours, the nasal bots, different parasites. And it also is helpful for deciding what you're going to do with the FOMACHA 3. It assesses 5 places on the animal's body to determine deworming need: the eye, FOMACHA score; the jaw for bottle jaw; the back for body condition score, as you see pictured here; the tail for scouring or DAG score; and then the nose for discharge. So let's say you had a FOMACHA 3 and his body condition, this is a kid goat, and his body condition score is a 2, and would you deworm him? I would probably deworm him at 2, maybe with a 2 FOMACHA score. But if he was up around 3, or I wouldn't do it. So I can use some of these other things, FOMACHA score of 3 and significant scouring, then I'm going to deworm him. So you can use it to help make those marginal decisions. The third thing you can look at to make deworming decision is performance indicators. Average daily gain. You deworm animals that fail to reach performance targets. We would use that in our buck test, again, to make a decision about a FOMACHA 3. If he did not gain weight, that FOMACHA 3 would be dewormed. Some places have developed a lot more sophistication in using average daily gain. They actually have called it happy factor, and they set a target weight, and if that lamb or calf doesn't reach that target weight, then they deworm it. So it works very similar to FOMACHA, it's just using a different criteria. Another area of performance that you can look at for making deworming decisions is litter size. Females that have larger litters are under more stress, they shed more eggs, and are more likely to require deworming. So it used to be recommended, and it's still probably done a lot, is to deworm ewes before lambing. Well, if you waited till they lambed and saw how many offspring they had, you could deworm the triplets, not deworm the singles, and then use other criteria maybe to decide whether to deworm the ones with 2. If you scan them ahead of time, you could also do it then. In Europe, they've done a lot of work with dairy goats, and they find that targeting the heavier milking females is a good option because, again, more offspring, more milk production, they're under greater stress, more likely to have high egg counts, and more likely to need dewormed. And when we're talking about the parapartner female, keep in mind she's a major source of infection for her lambs and kids. What about fecal egg counts? Generally, we don't recommend that you use fecal egg counts as the sole or primary reason to deworm. They're not always highly correlated to clinical signs. There's a lot of limitations to fecal egg counts. And you don't have them when you got the animals in the chute or the pen. You have a delay before you're going to have that information. What's better to do with fecal egg counts, because they're very useful, you can determine whether the treatment was effective. So you deworm an animal, kind of like that quarantine treatment. You deworm them, and then you collect the second sample 10 to 14 days later to see if that treatment was effective. If you want to know if you have dewormer resistance, we use fecal A counts. Only instead of doing a couple of animals, we probably at least need to do 10 or 12 or 15 animals, ideally, to find out if the worms are resistant to that dewormer. Fecal A counts are being used increasingly to identify animals that are more resistant or animals that are more susceptible. It's very important, if parasites are a big problem on your farm, that we really move towards getting, particularly the males that have documented resistance to parasites. And then again, looking on the female side, getting rid of the ones that are most susceptible. Fecal A counts can also be used to monitor pasture contamination. The last two things I want to talk about are other tools for managing parasites, particularly the barber pole worm. The first one is copper oxide wire particles. They have been proven to have effect against the barber pole worm. And there's at least one, if not two studies that show that when they're used in combination with a dewormer, it doesn't seem to have a lot of efficacy. They improve the efficacy of that treatment. So copper oxide wire particles are tiny metal rods of copper. As a treatment, they have less potential for copper toxicity compared to copper sulfate. In fact, all the research that's been done has never had any toxicity issues. They are available as copper supplements for goats, 2 and 4 gram, and for cattle, 12.5 and 25 gram. You can see the 12.5 gram product right there. What we recommend is repackaging those doses into smaller doses for deworming sheep or goats. They are copper supplements is what they're sold as, and they don't need as much for treatment. We want to selectively treat like we do with the dewormers, and lambs and kids get 0.5 to 1 gram, and mature animals get 1 to 2 grams. I think if you're a sheep person, it's going to be in your best interest to find out what the copper status of your farm is before you substantially use much copper oxide wire particles. Best way to do that is to test the livers of deceased animals, so either one that dies on the farm, or maybe you took some to the butcher and you can go ahead and get their livers and make sure you're not at the high end of copper already. But for goats need and require more copper, and the risk is probably very, very low. The last thing I want to talk about is one of the newest things, even though it's been on the market for a few years, and that's Bioworma. The Dunningtonia flagrans, that's the name of the Latin name of the fungus. It's a feed-through fungus that traps and kills roundworm larvae in the manure. So not just the barber pole worm, but other stomach worms as well. You feed through the animal, meaning it has no effect on the animal. So if the animal needs dewormed, you need to give it a combination treatment or copper plus a dewormer. What this does is it significantly reduces pasture contamination. So instead of focusing on the animal, we're focusing on the pasture where the majority of parasites are. There's two products that you see pictured here. Bioworma itself is a feed additive. It needs to be batch mixed in feed, feed supplement. The dosage is very low per 100 pounds, like 0.1 ounces, so there's no way you can accurately dose an individual animal. The other product on the right is called Livamol with Bioworma. It has significantly less fungus percentage-wise. It's a feed supplement, and that feed supplement can be mixed or top dressed with your feed. The company recommends that you feed Bioworma when temperatures are over 40 degrees. It's because this is when the parasites become active, that you focus that feeding to the most susceptible animals in the flock or herd. Again, the pair-partnered females and the lambs and kids. The biggest disadvantage of Bioworma is its cost. It's proven that it does what it's supposed to, but there's some different ways to reduce cost. Bioworma is significantly less expensive than using Livamol if you can buy it in bulk. Research is currently aimed at trying to find less expensive ways to use this product. For example, could you feed it for 2 weeks out of the month? That would cut the cost in half. Could we come up with a mineral product, and then that would eliminate the labor need of feeding them every day? So that's Bioworma. Like I said, it's been around a few years. It may have make sense on your farm or not. Final slide is tips for keeping sheep and goats healthy. Starts with buying healthy animals from reputable breeders. Don't buy diseases. They don't charge extra for diseases. Make sure you do the quarantine. Maintain as close to flock or herd as possible. In most cases, you have to buy outside males. They introduce fewer diseases than females, but if you can keep it mostly closed, that's going to do wonders. Nutrition is the foundation of health, so good nutrition, balanced rations, mostly forage diets. Some of the diseases, metabolic diseases we get are lack of forage in the diet. Vaccinations, regularly monitor for parasites and get certified in Forage. I think all of those things will help keep your sheep and goats healthy.